Let's get more on all of this from Amy Austin Holmes. She's an associate professor of sociology at the American University in Cairo. Really great to have you with us, Amy. What are your takeaways from all of this in terms of how this is sort of changing our movement as human beings socially?
Well, thank you for having me. It is indeed really uncharted water that we're in here. The United States has, not faced this kind of a pandemic perhaps since 1918. Um, so it's really something quite new, and people are just now learning how to adjust. I think that that what's this common phrase that's become very widespread now is about social distancing, but it's gone beyond that now. We're also seeing that curfews are being imposed in a number of cities. In New Jersey, I believe, is asking people not to leave after 8 p.m. This is something that people in the United States are not really accustomed to, and so also schools and universities have, for the most part, decided that they're going to move entirely to online teaching for the next 3 weeks, in some cases until the end of the semester, so through May or even June. And how effective this will be is also an open question. We have here in the United States, there are pockets of the country in rural areas, for example, that don't really have access to reliable internet even. So that's something also to keep in mind, um, as we move forward in this pandemic that we're now going through.
You bring up a really important point to a large extent. When you look at the challenges that the United States is facing, it falls really under the category of those sort of first world problems in terms of people not being able to get toilet paper and things like that. But you're also an expert on Syria, Egypt, and there's a lot of vulnerable communities in those countries. What are the challenges for them?
Well, that's absolutely right. There are reports, for example, in Syria, there are very serious concerns about the spread of the coronavirus. This is partly because of the presence of Iranian-backed or Iranian militias that are inside Syria. Given the high death toll in Iran and the spread of the virus in Iran, it's possible that the virus was transmitted this way. So there's the humanitarian catastrophe in Idlib, which has fallen a little bit out of the headlines recently because of the coronavirus, but the situation there is also still very dire. And that's in the northwest of Syria. In the northeast, the area that is under the control of the Syrian Democratic Forces, they do not have a single testing facility anywhere in the northeast, and there are some 4 to 5 million people who live there. The only border crossing into the country, was recently shut down in January, and now Damascus is going to try to, says they're going to be providing aid to the Northeast, but it's clear that the areas that are outside of the control of the regime are not their priority. And so it's not clear whether that aid will actually be forthcoming, which is desperately needed.
Well, we really appreciate you drawing attention to that. One of the interesting aspects that you were mentioning in your first answer was the fact that this is changing our behavior right now in a lot of different ways. People are working digitally from their homes. There's homeschooling. Travel has been restricted. People have gone into self-quarantine. How do you see this potentially reshaping the way society works together when you sort of look at the contingency plans that humans have had to come up with just to try to get on with everyday life?
Well, many people now are required to telework, right? So to work from home, which raises a question of how that's possible. As I mentioned, that requires a reliable internet. Will the internet that exists currently be able to withstand all of the increased demand on the internet providers, but also the issue of childcare for families that have children that are not in school anymore. They have to somehow adapt and take care of the children at home and also work at home at the same time. So it's not clear how that will also work out. But I would like to draw attention to the fact that in 2014, we did actually have a global office that dealt with pandemics. It was created after the Ebola crisis in 2014. When it became clear that we need, a coordinated, office that will be able to respond to a crisis like this. And unfortunately, President Trump shut that down in 2018. And so, you know, the anxiety that a lot of people are feeling now, this, anxiety about being isolated, about being in quarantine, how are they going to continue their jobs? Will they find childcare? A lot of that could have been prevented, or at least I think the severity could have been reduced if we had had a proper response much earlier, weeks ago, because the key now is to slow down the spread of this virus. And I think if we had had a different response weeks ago, we would be in a different situation now, and I think people would be feeling less. We would have less of a panic sort of situation if this had been handled, differently.
Absolutely. Well, panic is a good way to describe it indeed. Amy Austin Holmes, really appreciate you coming on and adding your expertise. Thanks for that.